It's a real honour to share because I identify very much as a member of the international CAH community, as the mother of a young person living with CAH. So it's a real honour to be with you all. I've been asked to introduce Clan and Mates for Kids, and I can see so many champions from the work that we've been doing, not just from CAH International and CARES Foundation, but also colleagues from Sri Lanka, Colombia, so many people on the call here today, and it's a real privilege. And I don't mean to speak about the work others are doing. They need to speak about their own work, but I can't help but reflect on some of the great things that different people are doing. So thank you for this. And I just also acknowledge this is Clan's 20th year, 2024. So it's a happy year for us. It's a year of celebrations, and we're really excited, not just about the past, but also the future. Now, let me see the best way to move forward. In Australia, we usually take a moment to acknowledge country. So I'd like to take a moment to acknowledge the traditional owners of the lands that Clan is headquartered on. Very privileged to live and work on the lands of the Wallumattagal people of the Eora Nation here in Sydney, and I pay my respects to elders past and present across Australia, but also acknowledge the lands that everyone's dialing in from across a million different time zones. It feels time zones are our enemy sometimes, but yeah, it's a privilege to all connect. And I just want to acknowledge that there are some people who have been working in the CAH community for many years, and we're sort of building on the shoulders of those who've come before us as well. So thank you to everyone for your contributions over the years. Just an overview of what I'll be talking about. I'll introduce myself first because I'll be new to some of you. Introduce Clan, talk about why we believe Clan's work is important and how we use our 5 pillars. We talk about our 5 pillars a lot, and our strategic framework for action, which is there on the screen. Talk about how we implement that framework and the pillars, where we work, with whom, and then introduce you to Mates for Kids, which started in about 2021. It's a more recent movement, and then talk about where we're going with Mates for Kids. 2030 is a big year for us. It's when the UN member states have committed to deliver on the Sustainable Development Goals. So I'll talk more about that. But then I really want to sort of spend a bit of time at the end talking about what can we all do to help, how can we all work together on this. So a bit about me personally. I mentioned I'm the mother of a young person living with CAH. Our eldest son was born in 1999 at a time in Australia when we did not have newborn screening for CAH. And for anybody who's gone through that process with a boy with CAH not picked up through newborn screening, it's a very traumatic experience. He was very healthy, 4.3 kilos when born, but 3 weeks later it was a very different story. And I just remember asking my husband to take that photo because I did have a feeling that we were going to lose him. But then fortunately, even just asking for that photo, I feel that photo saved his life because it snapped me out of it. And I went, come on, Kate, quick, do whatever you have to do. And he was diagnosed that same day. He was really very sick, and it gives me a great passion for newborn screening, I have to say. We're very fortunate, though. We live in Australia. We have affordable access to medicines and very high quality care. He had a wonderful paediatric endocrinologist who cared for him. And we have 2 other children. And Joseph is now 25 years old. He's actually the treasurer of Clan, and he gives me permission to share his photos. And he's getting married. He's finished university. He's working full time. It really, there's not a day that goes by where we don't feel really grateful. And I think gratitude really drives a lot of the work that I personally do with Clan, having really almost experienced the worst, but also feeling like I experienced the best. There's a very strong desire there to give back to others. Just a brief introduction to Clan. I mentioned this is our 20th year, and it's been a long road. We're very clear on our mission, our vision, and we really want to maximise quality of life for children and families living with chronic health conditions in resource-poor countries around the world. We started with a specific focus on CAH, but as I'll speak soon, we were soon asked to translate that focus to other conditions across a range of different countries. So while CAH is very close to our heart, we do work with other conditions. We have spent a lot of time and effort, and I must acknowledge the Vice President of CLAN, Kath Cole, who's our policy process guru and queen, and many of you will have met her. But we are fully compliant with the Australasian Council for International Development, the ACFID Code of Conduct. That's a very onerous process, but it does then help us be approved for taxation with the Australian Taxation Office for tax deductibility status, and also overseas aid gift deductibility status. And we're formally associated with the United Nations Department of Global Communications, which used to be the UNDPI NGO, for those who may know it by that name. And we're also in special consultative status with ECOSOC, which is the UN's Economic and Social Council. And I guess really just sharing that information is just to say, I'd just like to acknowledge for all of us who are running support groups or running NGOs, there's just so much work involved in policy and process and behind the scenes and doing it right. CLAN actually has a secret sixth pillar. Our pillar 6 focuses on ethical and transparent program management. So it's a very important part of who CLAN is and how we operate. But getting to the story of CLAN, it really started when our son was about 5 years old. And I really want to acknowledge CARES Foundation and CAH Support Group Australia, who ran stories in their newsletters at the time, written by Professor Gary Warren, who was a paed endo at Royal Children's Hospital, Melbourne, here in Australia, and Michelle Konheiser, the mother of a young person living with CAH here in Australia. And they had been to Vietnam and they shared their stories, and it was heartbreaking. I just had my 3rd child and I was completely hormonal and just couldn't stop crying the whole time I read these stories. But stories of parents giving their child 1 tablet every few days because they couldn't afford it every day. The supply was unreliable. The black market could charge whatever they wanted. Families just couldn't get the medicine. 1 bottle of tablets costs the equivalent of 16 bags of rice. That's an enormous amount of rice. You know, sometimes you just have to reflect on these things to let it sink in. And there was no 17-OHP testing, poor surgical outcomes, and several deaths annually. And I rang Gary Warren because at the end of his letter, he wrote, "What can you do to help?" And that really struck me. What can you do to help? And I really didn't know. I rang him up and had a yarn with him, and he said, "Kate, can you fundraise?" And I said, "No, I can't." And I still can't. And I want to acknowledge that, you know, we all have different gifts, and I'll get onto it later, but fundraising was not my strength. But he invited me to come with him to Vietnam. And by that stage, I'd done my Masters of Public Health and prepared a survey so we could consult with the families in Vietnam, but also take over some medicines. I reflected that I'm a medical doctor and I knew what medicines my son was taking. So I contacted Alpha Farm, which made the hydrocortisone tablets he used, and Bristol Myers Squibb, which made the Florinef tablets that he took, and was able to secure a 3-year donation of enough medicine for every child with CAH in Vietnam. And that sounded great, 3-year supply, but someone had to organise it and manage it. And I pretty quickly came to realise that was going to be me. So that's I sort of fell into it in that way, I guess. It really was transformational, and CLAN still does take that approach of a 3-year donation wherever we can, because in-country partners need a lot of time to be able to establish supplies, to get the drugs registered, to find which suppliers they want, and to get the drugs on their national essential medicines lists and so forth. So so that's the approach that we took. But really, it was the consultation with the families it was a 12-page survey. It was very long. People said, "Oh, families won't do it," but honestly, no one had spoken to the families before, and they just wrote page after page after page. And this is where Clan's strategic framework came from. And the families in Vietnam said, "Look, we need 5 things for our children to have the best life. We need affordable access to medicines and equipment. We need education, not just of ourselves and our health professionals, but also of our government. We want the world to know. We want other NGOs to know. We want the UN to know. We want everyone to know. We want advocacy. We want the best quality care. We want a strong support group. We want to be with other people who understand, and we want to be free from poverty. We want to be able to care for our children ourselves." And taking a rights-based approach and a community development approach, CLAN does not support individual families. We look at all children living with the same condition in a country as one community. So the CAH community, for example, of Vietnam, how do we help them have the highest quality of life? We focus on those 5 things, and we work with as many different stakeholders as we can. And that framework hasn't changed in 20 years. The more we worked with the families, the more we started to learn about the importance of affordable access to medicine and the impact of poverty. And it was very moving meeting a child the exact same age as my own at one stage, just adrenal crises, had had an enormous impact on his development. And it wasn't just children who were dying, it was developmental delay, it was all sorts of morbidity, stigma, isolation that people were experiencing. But what we could see when we looked at the register of all the patients at the National Hospital in Hanoi was that we had quite a lot of little babies, but very few older children. So this really demonstrated loss to follow-up, which really is as good as saying mortality. We also noticed that when we looked at the average annual income of the families we were seeing, their average income was way above the national average and certainly far eclipsed the average income of rural poor families. So we were really only seeing the survivors. There were a lot of children dying. A rights-based approach is really important to CLAN. When we reflect on those 5 pillars and then we look at the UN Convention on the Rights of the Child and the 54 articles there, all 5 of those pillars, all 5 of those requests are covered. And we have a child-friendly rights flyer, and I'll share a link to it in the chat later. But we have gone through and put in child-friendly language each of those 5 pillars and drawn on the articles in the convention to explain to families and communities why this is a matter of justice. This isn't the CLAN, it's not a charity. This is a matter of social justice. The children actually have a right to the 5 pillars. And Nelson Mandela said that a lot better than me. But addressing these issues, it's not charity, it's justice. And this is a very famous image that we're all really familiar with, but I just want to touch on it and say that it's not enough for us to do the same for every child with CAH around the world. Children in high-income countries and children in low-income countries, they need different approaches. And yes, we need to do more for children in low-income countries. But even more than that, we need to address the structural barriers. An example is affordable access to medicine. How do we do that? One example was that in 2008, CLAN worked with other stakeholders to get hydrocortisone and fludrocortisone on the WHO's essential medicines list for children, for example. It's looking at those sort of structural barriers that we can address that can help us protect and promote the rights of children and enact justice. So what does it look like in real life? All of this work on the pillars. Well, pillar 1, I mentioned getting the drugs on the essential medicines list for children. That's not a panacea, unfortunately. Humanitarian donations of drugs I've spoken about. Pillar 2, education, translating educational resources into local languages is very important, and one of the first steps that we would encourage. Research, consulting families, health needs assessment, very important. And rights-based advocacy and advocacy in general. Pillar 3, optimal medical management, training health professionals. We had Claire Henderson, an Australian nurse, in Hanoi for 6 months, training nurses. She was a diabetes nurse educator, also living with CAH herself, a really remarkable young person living with CAH. And she trained an entire generation of nurses on management of CAH and diabetes, actually. This is support groups, Pillar 4. At a minimum, we'd encourage a big support group once a year. And it's not the support group that is the panacea. It's all of the pillars that happen in a club meeting. And I really do want to acknowledge the incredible work Columbia's done. And Columbia will be presenting on some work they've been doing enacting the 5 pillars recently. But just that really holistic, comprehensive approach, they've really done exceptionally well. And Pillar 5, reducing financial burdens. Look, all of this reduces financial burdens when you help people access medicine and help them take care of their child so they're not continually going back to hospital and they're not always sick, for example. But also encouraging families to take out health insurance, and encouraging children to go to school. These are children in Vietnam getting awards for good performance at school. These children need to be financially independent in the future, so helping them achieve that. We were then asked to translate CLAN's framework over to diabetes, which we did in 2007, started then, and exactly the same process, exactly the same way with the pillars. And I would say that we've seen remarkable changes in Vietnam for both CAH and diabetes. CAH, for example, when I started, I mentioned there were about 100 children alive in Vietnam. And in March of this year, we had confirmed that there are over 2,000 children with CAH in Vietnam now. And they all have access to medicine free on the National Insurance Scheme. And they're doing some wonderful work there. We also translated the model to osteogenesis imperfecta, Duchenne muscular dystrophy. I did my Doctor of Public Health on nephrotic syndrome, autism. There's a whole range of conditions that the model's been translated to. And where do we work? Within Mates for Kids, but with CLAN, we acknowledge the 6 regions of the world that WHO acknowledges: the African region, the Americas, Southeast Asia, European, Eastern Mediterranean, and Western Pacific region. And we have worked with CAH communities and other childhood NCD communities in all of those regions now. This is the OI community in Indonesia, CAH community in Fiji, diabetes in Pakistan, Colombia's CAH community, and this is epilepsy in Uganda, for example. In 2009, CLAN started to engage with the UN, and we were fortunate to attend one of the first UN conferences in Australia that focused on health. The theme was Advanced Global Health. And we held a panel discussion and also a side event. And our message was very simple. Our message was that children get chronic diseases too. There was no point in focusing on CAH. We made it more broad and more general. But at that point in time, everyone was talking about chronic disease, and they were talking about adults getting heart disease or smoking-related lung disease or cancer or diabetes. And we were saying, look, kids get cancer, kids get diabetes, kids get, heart disease, rheumatic heart disease. And it was a terrific event. But the best thing about that event, and it's one of the best things about all events, is who you meet and the networking and the opportunities. And someone came up to me afterwards and said, have you heard about the UN high-level meeting on NCDs that's going to be in New York next year in September 2011? And I hadn't. And it was only the second time in the UN's history that the UN came together for a health-specific topic. The first was in 2001 on HIV/AIDS, which we can all appreciate was really very important. But member states, the UN really recognised that NCDs were really important. They were going to bankrupt countries. Countries had to do a lot about preventing NCDs, so smoking, alcohol, unhealthy foods, physical inactivity, air pollution, and also managing NCDs like diabetes, cancer, heart disease, smoking-related lung disease, and mental health conditions. And we formed, I was invited to be the chair of the NCD Alliance child-focused working group. And the NCD Alliance was, and still is, a civil society alliance of the big four at the time was the International Diabetes Federation, the World Heart Federation, the UICC for cancer, and the Union for TB and lung disease. And we basically formed this briefing paper and formed a coalition called NCD Child. And we really advocated very strongly for the inclusion of children and a life course approach within the declaration that was to come out of the high-level meeting. And I looked at the draft declaration in late 2010 after our UN event in Melbourne, and there was not a single mention of children. I was invited to speak at a civil society meeting at the UN in New York in July of that year, and with our collaborative advocacy, we were able to get mention of the importance of including children and young people in a life course approach to NCDs in the final declaration. There was still no real acknowledgement, though, that children get NCDs. They really were focusing more on prevention. And so we continued to advocate. We brought some very strong partners. We worked with UNICEF, Save the Children, Johns Hopkins, Harvard, the International Pediatric Association, CLAN, like they're all the same, sure. But we brought a whole lot of people together, and we continued the work of NCD Child. We held 2 international conferences. We ran multiple UN side events, and it was very rewarding and gratifying and encouraging in May 2013, when member states at the World Health Assembly in Geneva approved this resolution that said children can die from treatable non-communicable diseases such as rheumatic heart disease, type 1 diabetes, asthma, and leukemia if health promotion, disease prevention, and comprehensive care are not provided. Now, of course, it would have been lovely to have had CAH included in that list, but that was, really not going to happen. But it was the first time, and it was very important because now you have, say, the WHO's pocketbook for hospital care for children, including chronic health conditions, whereas previously it just really focused on pneumonia and gastro and immunisation and so forth. So it was exciting. I'm going to skip forward now to 2021. Between 2011 with NCD Child, we planned transition NCD Child over to the American Academy of Pediatrics. And we focused really in the Asia Pacific region on, doing CLAN's model, working with countries with CAH, but also other conditions. And I was doing my doctorate on nephrotic syndrome in Vietnam. But in 2021, by this stage, we knew that mortality for CAH in Vietnam was next to zero. They haven't lost any children already diagnosed with CAH in Vietnam, as I said, since 2017. So we knew that it was possible to just stop children dying once they were diagnosed. That's a key point, because unless you have newborn screening, you're not diagnosing. So some children will still die until you have uniform access to newborn screening. But they're getting very good at diagnosing CAH clinically in Vietnam. So we knew that it didn't have to be bad, but doctors and Trudy from Child and Youth Care reached out to CLAN, and the situation for a country, Zimbabwe, with, is it 12 million people or something like that? They had between 10 and 20 children alive with CAH. And even in the time we were negotiating getting a humanitarian donation of medicines, Trudy would write to me and say, "Oh, we just lost another child last week. We just lost another child." It was heartbreaking. So we enacted the framework. We managed to get some medicines from Pakistan, who we'd been working with since 2007, and it only cost $30 to get enough medicines, hydrocortisone and fludrocortisone, to keep one child alive for 1 year with medicines from Pakistan. That's how cheap these medicines are. So that's how cheap they can be, I should say. So we were able to supply enough medicines. They didn't lose any children in the whole time that they had the medicines there, and they were able to hold their first support group meeting, start educating families, and so on and so forth, doing the pillars. So we decided that rather than trickle, trickle, trickle through different countries, we needed to do something differently. And we formed Mates for Kids, which is about maximising access to essential supplies for kids. And this is maximising access to essential medicines, but also equipment, injection for sick days, but also newborn screening equipment, whatever equipment you need to have a happy and healthy life with CAH. And acknowledging that the SDGs were closing in 2030 and acknowledging SDG 3.4, which states that member states commit to reducing the preventable mortality associated with NCDs by 30% by 2030, we said, well, let's be really bold and let's try and reduce the preventable mortality associated with CAH around the world by 30% by 2030. Why shouldn't we? The SDGs commit us to doing that for NCDs generally. Why shouldn't we just try it just for one NCD? So we met with WHO in late 2021. They asked us to write a briefing paper, which we did and delivered in 2022. And coincidentally, at this exact time, we had two countries reach out. We had Ukraine. Colleagues in Europe reached out because doctors in Ukraine couldn't access hydrocortisone and fludrocortisone. And we had colleagues in Sri Lanka ask urgently for help given the financial crisis. And I really want to acknowledge here the German CAH community who came together. And thank you to Johanna particularly for the amazing work the whole German CAH community did. And we were able to donate supplies to Sri Lanka. And no children died of CAH during that financial crisis. And I just can't acknowledge the doctors in Sri Lanka strongly enough, Drs. Navoda and Dr. Simadhu, who are on the line. And likewise with Ukraine, we worked with GPED and CARES and a whole lot of different stakeholders, CAH International, and managed to get the medicines they needed. So this was proof of concept. So this is 2021, 22, when we're working with Ukraine. This is 2030. This is the SDGs. What can we do and how can we reduce preventable mortality? We know it takes a long time. Vietnam was here, the first UN high-level meeting, 2011. The second was in 2014. The third meeting on high NCDs at the UN was 2018. We have the fourth one coming up next year in 2025. There are lots of other UN events, though, that we can engage with. And we are saying, okay, well, let's look at what this might look like. So what do the numbers look like? If we're only going to focus on lower income countries, and the World Bank says there are low income, low middle, upper middle, and high income countries, we're not going to focus on high income countries. There's too much to do. We have to limit ourselves to this. The WHO breaks the world up, as I mentioned, into the 6 regions: Africa, the Americas, Eastern Mediterranean, Europe, Southeast Asia, and Western Pacific. So what does this look like? Well, if we break it down by those numbers, in each of the regions, this is how many countries there are in total. But if we take out the high-income countries, and I do acknowledge that in some high-income countries, some families can't afford the medicines, and that is a tragedy. But that's a separate discussion, and we really don't apologise for the fact that from an equity perspective, we are going to focus on those with the greatest need. So taking those countries out, there are then 132 countries which fall within those 3 categories. And if you say 30% by 132, that's where we get our rough thing of saying, okay, we need to reduce mortality by 30% in at least 40 countries to sort of be on track to achieve SDG 3.4. So how are we going to do this? We're very grateful to WHO for allowing us to use a platform on their knowledge action portal for NCDs for Mates for Kids. And that's where we have a repository of information. We will be storing some data there, connecting, but it also helps us share stories more broadly with WHO and others about the work that Mates for Kids is doing. We have committed to bringing together, setting up this community of practice, which is has the platform on the CAP, the WHO's platform, And this is the community of practice. We keep the CAH community at the centre of the focus. We involve as many different stakeholders as we can, and we meet regularly as Mates for Kids community of practice. We commit to meeting every quarter. One quarter, just by virtue of time zones, one quarter will have the Americas, Africa and Europe champions talking, and the next quarter will have Western Pacific region, Southeast Asian and Eastern Mediterranean regions speaking. And every single meeting, we focus on three things. We focus on access to medicines, strengthening CAH community, and scaling newborn screening. They're the three objectives that Mates for Kids has set that we think that we can focus on to achieve the SDGs. I'd also acknowledge SDGs 3.2.1 and 3.2.2, which focus on reducing neonatal and child mortality under the age of 5. Again, very relevant to what we're doing. How else do we do it? We form a toolkit. So we focus the knowledge action framework, which was first published in 2006. And basically it's sort of continuous quality improvement, action orientated. So you identify the problem, you identify local solutions, you decide on solutions, you enact them, you evaluate them, and you go around again. And through that whole process, you develop tools and resources that can really help scale your work up progressively. And this is where we've set up the Mates for Kids toolkit. We're going to have it on the Knowledge Action portal, but it's based on our website, and that's the Mates for Kids website. And I can share a link to the toolkit after this. And we also put all of our reports and resources that we develop, but also that other champions develop. We make sure that we host them on the CAP so people can, on the toolkit, so people can access them. Data is going to be very important. We've identified a series of tools and indicators that we're going to use to map progress moving forward. Our team in Colombia are our first champions who've completed all of the tools and have all of the indicators used. And it's very exciting, the work that's happening in Colombia. And I just want to acknowledge Dr. Paola Duran and her wonderful team and the CAH community in Colombia. They're very dynamic and very exciting what's being achieved there. So we'll be using these indicators to map progress and drive change. One is the check tool, and I'll speak to that in a little bit. The team in Sri Lanka did a fantastic job using that for the first time. Another thing we're going to be doing is leveraging events. So I mentioned the different UN events. This is the World Health Assembly this year in Geneva as an example. And we were pleased to host a hybrid event. We had in person the Minister for Health for Indonesia talking about the great work they're doing on newborn screening. WHO spoke, colleagues from Africa, the International Society of Neonatal Screening, really talking about the importance of scaling newborn screening. And again, it was encouraging. The resolution that came out of WHA this year, for one of the first times, I can't remember seeing it previously, really spoke about the importance of newborn screening. And certainly it's clear that WHO, this is a field that they're talking a lot more about these days, which is exciting. Another very exciting thing we're proud to be doing is sharing grants. So far, we started these in late 2023 and the first recipient started in 2024. I'd like to specifically acknowledge Sri Lanka in our first rounds. Sri Lanka and Colombia were our first grant recipients. So Sri Lanka has done some remarkable translations, and I'll try and share a link to that in the chat. They also used the check tool, which is, it came out of the research that we did on nephrotic syndrome in Vietnam, helping to identify children who are most at risk, looking at the social and cultural determinants of health. And Dr. Navoda and the team at all of the centres actually have been using that. In Colombia, they held their very first CAH Club meeting on the 10th of March with a small grant. These grants, I have to say, are 1,000 Australian dollars. We're not talking about a huge amount of money, but the work that the teams do with that small amount of money is truly inspirational. So the CAH Club in Colombia, they've translated some resources, they've been doing some research, they did a health needs assessment, they surveyed the families, they're starting to really understand the CAH community's needs. They developed resources to help families navigate the health system and access financial support. Really exciting things. Our round 2 grant recipients were announced at WHA. We're really proud to be supporting the team in Uganda, who will be looking at supporting health practitioner capacity building to prepare for newborn screening. In the Solomon Islands, they're going to start doing a newborn screening pilot. And in Kenya, again, they want to focus on newborn screening as well. They're all interested in CAH in the future, but obviously there's other conditions like hypothyroidism and sickle cell disease, which are important. So just towards the end here now, I just really want to ask, what can you do to help? It's the same question that I read in Gary Warren's paper. What can you do to help? And I don't know what the answer is for every single individual person, but I do know that we all have a role to play. And I do know that many of you are already playing your role over and above. But the whole thing about Mates for Kids is in Australia, we're mates, we're friends, as one, we're all part of the CAH community, we're mates. So how can we all work together to make sure that everyone in our CAH community has the same opportunity to achieve their full potential in life? And we've come up with sort of 5 suggestions, and that's what I was trying to think, what does 5 look like? And the Olympic rings, my husband actually suggested the Olympic rings, which fits in nicely with this whole global focus as well. And it also fits with being really bold. And we're not setting tiny goals here. 30% reduction in mortality by 2030. It's pretty audacious even saying that. So if we are going to get gold here, what do we need to do, or what could we do? And I'd just firstly say to everyone, look within yourself and follow your own passion and leverage your strengths. When I first spoke to Gary Warren, he said that I could fundraise, and I know I can't fundraise. I still can't fundraise. We're all different and we all have different skills and talents, but if we can bring our skills and talents to the CAH community and play our own role, the beautiful thing about Clan's strategic framework for action is that we don't all have to be doing everything. One person would be saying, well, I'm actually working on this part. I'm actually doing access to medicines in this country, or I'm doing support groups in this country, or I'm doing translation of educational resources in this country. We don't all have to do everything, but what is it that you're really passionate about, and what are you good at? Is it data? Is it marketing? What is it? And what could you bring? The second thing is, I'd say, connect with others, and it takes a village. No one of us is going to achieve everything. We have to do it together. I think at that national level, connect in with your own CAH club. At the international level, CAH International, CARES, other CAH clubs around the world. These meetings, really powerful when we all come together. We'd welcome everyone to join Mates for Kids and join the WHO CAP. And if you have things that are really useful, if you could share them with the Mates for Kids toolkit, that would be great. I'd suggest sharing your story, telling your own story, but also your country's story. Stories are really powerful. It was Michelle Kornheiser and Gary Warren telling stories in the first place that helped me understand what was happening in Vietnam. If we don't tell the stories, we don't know. That can be using stories with data and helping us collect data from countries. But WHO really speaks about the importance of meaningful engagement of people with lived experience. And I'll share a link in the chat with this brilliant video that a young woman living with CAH in Colombia did after the first CAH club meeting in Colombia. And we shared that with WHO, and it's been a very powerful video. People's stories are really powerful. When you share your stories, we can get them up on the WHO's CAPs, and we can share them with others as well. Fourthly, I'd say, please consider getting behind the bold goal of 2030-40. We have now issued 6 grants. We're going to be releasing the 3rd round of grants on the 28th of June for International Neonatal Screening Day, and we'll be offering another 3 grants. Each grant is $1,000. People are welcome to name a grant after themselves or their country, whatever floats people's boats. But if you want to help fundraise so we can have those 40 grants, that's great. Once we get those 40, $1,000 grants. From there, we want to be able to issue second round grants to countries. These countries like Colombia and Sri Lanka who've done amazing work, we'd love to be able to give second round grants, but we have to sort of really make sure we spread out to other countries. But the more funding and resources we have, the more we can help countries in locally to drive change. And it might not be financially that you are able to support things, even just practical support and offering to support grant recipients would be great. If you're wanting to donate to it and you want to put in a message there that you want to have support a grant, or you want to have a grant named after a particular country or so forth, we're very open to that. And finally, I'd just say we always have to remember we're one community. Really, I'd encourage everyone to, I'll put a link in about our human rights, really get across the UN Convention on the Rights of the Child and what our rights are and what our children's rights are, and think about equity. If you're in a meeting, if you're in an innovative meeting around access to medicines, that's great, but what does that mean for children in low-income country? If we're talking about stem cell therapy, that's great, but how's that going to be, made available to children in low-income countries in the future? We have to really be working as one community, and we all have a role to play in that. So they'd be 5 suggestions that we would have about how people can get involved with the work of Clan or Mates for Kids moving forward. So that brings me to the end. I just, finish by saying we really do all have a role to play. I can share a link to this paper if you like, and people can read more about what Clan is and how we work. We do really believe that we can make a difference if we all continue to work together, and just very grateful for this opportunity to share, and happy to answer any questions, but mostly just want to really acknowledge the true champions who are there in the field locally, the CAH communities all around the world who are doing really amazing things in very, very, very difficult circumstances. And I would say we're having meetings with the teams from Africa at the moment, Zimbabwe, Nigeria, Uganda, very difficult situations. So, we've got a lot to do. So thank you. Thank you very much.